Hello everyone, hope everybody is doing well. So welcome to our part 4 of this webcast series focusing on feline infectious diseases that you guys can find in catteries. So if you're breeding cats and you want to know more about infectious diseases, that's definitely the place to be. So in the previous episodes we focused on sanitary prophylaxis, the importance of medical prophylaxis, GI disorders, and I told you that in catteries there are three main kind of disorders we can end up dealing with: GI, gastrointestinal disorders, respiratory disorders, and skin issues. Today we're gonna discuss the respiratory part of those disorders. So without further ado, let's jump to the slide deck that I prepared. And okay, so let's go for the respiratory disorders that you can deal with in catteries. And I think this is something very important to discuss because respiratory disorders are certainly the most common disease you will encounter in catteries. And I work with lots of catteries, and I never found one that told me they never had an issue with respiratory disorders. And when we speak about respiratory disorders, it's something we often refer to as feline upper resp diseases, upper respiratory infection, URI. These are terms you might have heard. And these terms, it's important to keep in mind that they are generic terms. They in fact define these kind of symptoms you can observe: coughing, sneezing, oral ocular ulcers, eye infection, hyperthermia, anorexia. So when we speak about feline upper resp, we can see a combination of all these different sides, and it can vary in terms of severity. It's a very um heterogeneous presentation. But what I want to tell you here when it comes to feline upper resp is that it's important to keep in mind that it's not a disease, it's a syndrome. A syndrome is a combination of clinical signs that can be related to many different potential causes. When it comes to upper resp in a cattery environment, it's always important to focus, obviously, on infectious diseases. There are infectious diseases that can cause feline upper resp, feline herpes virus, feline calicivirus. I would even say feline caliciviruses because there are many of them. Chlamydophila, Bordetella bronchiseptica, Mycoplasma. All these names are pathogens that can potentially cause upper resp in your cats. They can act synergistically. They can be a combination of some of them or only one of them, but they can all cause upper resp. And you might have heard that when you have ocular lesions, it's more often due to herpes virus. When you have ulcers, like oral ulcers especially, it's more suggestive of feline calicivirus infection. Keep in mind one thing: in catteries, you can have any of these signs with any of these pathogens. So unfortunately, just based on the clinical signs, you cannot diagnose which pathogen caused the disease. And to complicate it a little bit more, it can also be related to non-infectious factors: foreign bodies, trauma, environment. If the ventilation of your cattery is not optimum, then there are more risk for these animals to develop upper resp just because their respiratory tract is more irritated because there's no proper ventilation of the cattery. So, and to make it even more complicated, very often it's not an infectious or a non-infectious cause. It's a combination of infectious and non-infectious causes. So upper resp, very common in catteries. Keep in mind that there are different origins, but in catteries, you should always keep infectious in mind because this is always something to look for. And in catteries, as I said, there are many different pathogens that can cause upper resp. What we know in catteries is that the two most common pathogens that are found to cause feline upper resp are the feline herpes virus, feline herpes virus 1, and the feline caliciviruses. And what is interesting, look at the colors. You see that the pink here means upper resp disease, but the green means no upper resp. We can find those pathogens even when cats do not show any clinical signs. So it's not because you don't have upper resp issues in your cattery that those pathogens are not present in your cattery. You can see that they are very common in catteries, and I'm going to explain you why. We're not going to focus just on those two pathogens because, again, they are the most important one in catteries. The feline herpes virus, the one we call FHV1. One first thing I want to tell you about feline herpes virus. Herpes virus are species specific. The feline herpes virus can only affect cats. It's not gonna affect humans. So don't worry, you won't get herpes from your cat. However, it's a very, very common disease. In one study, it showed that 97% of catteries had individuals contaminated with herpes. So you cannot get rid of herpes so easily. It's a disease which is a virus which is well implanted in the feline population. And you see, typically the cats can get infected by, when they are infected by herpes, they will develop an acute infection. So they will develop an acute upper resp syndrome. And after 2-3 weeks, herpes doesn't usually kill cats, clearly. Those cats will become asymptomatic. It looks like they're cured. But herpes virus are very smart viruses. So typically what they do is that they will hide somewhere in the brain of the cat and they will wait again for some stress factor that will decrease the efficiency of the immune system. And when the immune system is down, is less efficient, they will reactivate, and again you will have maybe a symptomatic animal, but most of the time they have no symptoms, but they're just shedding the virus. So you have clinically healthy cats shedding the virus. When a cat is infected with herpes, typically it is infected for life. And remember what I said at the beginning. In a study that was performed a few years ago, 97% of catteries were positive for herpes. So you cannot get rid of herpes because most of the cats are already contaminated. So the best way to prevent the side effects of herpes is to fight the stress that will lead to the reactivation of the pathogen. And it's even more tricky when it comes to calicivirus, because calicivirus, you see that the animal is infected, so it develops an acute upper resp episode. And obviously, again, most of the calicivirus are not that aggressive. The cat will become asymptomatic. It looks like he cleared the infection, but he's still shedding the virus. 50% of cats still shed the virus 75 days after infection. So for a long time, even if they look okay, they are still shedding the virus, and this virus can infect potentially other cats. And then they will become asymptomatic. However, some cats will indeed clear the infection and they will eliminate the virus and they will be okay. But some cats will become chronic shedders, so they will spread the virus for their entire life. So that tells, and to make it even more complicated, calicivirus, today you know that we can vaccinate for calicivirus, and that's a very good way to protect our cats against the most common calicivirus. But you need to keep in mind that there are several different types of calicivirus. It's an RNA virus. It mutates a lot. So we have many, many, many different strains, and the vaccine cannot cross protect for all those different strains. So it's when you vaccinate cats against calicivirus and even against herpes virus, and if they develop upper resp, for calicivirus, it's not because the vaccine doesn't work. It might be because he's dealing with a totally different strain again. So that explains you why calicivirus infection is so common in cats and in catteries. Very, very hard to know which strain we're dealing with. And also, there are many different situations where the cat looks healthy, but is still shedding the virus. So what to focus on when it comes to feline upper rest to better protect our cats in catteries? Clearly, the first thing to do is to prevent stressful conditions. Stress is one major factor of reactivation of the herpes virus. And in shelters, I work a lot with shelters, and upper rest is also a big deal for them. Very often what they notice is that when the cat arrives at the shelter is healthy, but because of the stress of intake of entering the shelter, in a week after arriving at the shelter, he will develop upper rest. So it's important to do whatever you can to prevent the effect of stress on these animals. Avoid overpopulation, for instance. These are very important things to do to protect your cats against upper rest. Sectorize. When again overpopulation can be an issue in catteries. If all the cats, if you have 20, 30, 40 cats all living together, that's definitely an environment which is at risk. So if you can, especially for kittens at weaning, etc., it's good if you can separate them from most of the adults to avoid too many animals living together, stressful conditions that can impact the development of this kind of disease. And sanitary and medical prophylaxis will be key. We already discussed that in our previous webinars, but keeping, for instance, calicivirus is resistant in the outside environment. So they can be transmitted through the environment. So it's important for you to use cleaning and disinfecting protocol that will target calicivirus and that will help you control the amount of those viruses in the environment, and discuss how to medically protect your animals, how to properly vaccinate them. Again, remember, vaccination protocols may vary from one cattery to the other, but it really depends on your specific situation, and that's a discussion you must have with your veterinarian. Coming back to sectorization, something I forgot. When you have a cat that a new cat that arrives at your cattery, isolate this cat. No, it's not isolate. Sorry, quarantine the cat to observe if he's going to develop upper rest symptoms or not. Because if you mix the cat too fast inside your feline population, that might generate a stress that will lead to upper rest. So the use of quarantine is important in breeding catteries, because if you don't quarantine your animals and if you integrate them directly inside your cattery, it might increase the risk of seeing an outbreak of upper rest in your setting. So that's what I wanted to tell you on upper rest this afternoon. So I hope you learned a few things. I hope you understood how important those simple things like quarantine are to better prevent the risk of upper rest in catteries. Again, it's a syndrome. It's not as easy as that. And we have talks that last 3 hours just on this single topic. There are lots of information you can find on our website, so don't hesitate to go there, comment, share your experience, discuss with us. The more constructive discussion we can have, the better for the feline breeding community. Thank you very much for attending this webcast, and I hope to see you for the last episode we will have. This time we'll focus on skin disorders. Bye-bye.